There are many reasons for miscarriage. There's been a lot of work undertaken in the area, and the most common reason that has been determined for miscarriage is a chromosome abnormality with this particular baby. Chromosomes are like the genetic blueprint for the pregnancy, and if the chromosomes aren't shared properly or are abnormal, then frequently the blueprint isn't there for a baby that's going to go home, and the pregnancy will stop either in the first trimester or over the course of the pregnancy. The other causes for pregnancy loss include differences with the uterus itself. This is a less common cause, but such as fibroids, which 1 in 5 of us have, particularly if they're located under the lining of the womb, or occasionally we can have walls of division within the womb that impact on an embryo implanting. From the point of view of maternal health, there are other conditions that can also increase the chance of pregnancy loss, particularly smoking, recreational drug use, and some chronic illnesses. So we would ask every woman that they enter pregnancy as healthy as they possibly can, and if they're anticipating a pregnancy, to have a chat with their healthcare provider if they're on medication, in order to try and see, do we need to change this medication? Do we need to alter the dose? But not to stop your medication, but to see which medication is safest, particularly for early pregnancy. Absolutely not. You're not alone in this, in that most women who miscarry will experience grief. You didn't do anything to cause the miscarriage, and you couldn't have done anything to prevent it. Grief is very much individual, and the one thing I would ask and I tell you is that you're not alone. Link with the organisations that are out there. The Miscarriage Association of Ireland was founded by 2 women who miscarried 30 years ago and left our maternity services feeling lost and bereft, and they exist to provide support for women who have miscarried in conjunction with other organisations and with our maternity hospitals. It does take some time to heal. I think physically women heal very well and very fast, but emotionally the journey can be longer. Talk to your friends, talk to your family, talk to your support group, and do everything you can to heal as much as you can in advance of a future pregnancy. No, in fact, the converse is true for most women, in that you've just proven to us that you can get pregnant. It is hard and it is a loss, and it leaves many women with empty arms. But more often than not, your body is perfectly healthy, and we will see you in much happier circumstances in the future. When it comes to stress, it more likely creates difficulty with actually producing an egg, which makes cycles irregular and ovulation points difficult to pinpoint, but very rarely does it cause a miscarriage. It would only have to be in extreme circumstances, and there is limited data on stress in causing pregnancy loss. Ideally, we want every woman to come into pregnancy as healthy as she possibly can, starting her folic acid 3 months postnatally, stopping smoking, optimizing weight loss, and again, if you have a chronic medical illness, making sure that you're on the appropriate medication and linking with your healthcare provider to talk about your plans of pregnancy. We would always recommend prenatal supplements, particularly that you would take your preconceptual folic acid for the 3 months pre-pregnancy. Unfortunately, in Ireland, as you know, we don't get a huge amount of sunshine, and so when you are pregnant, we also discuss vitamin D supplementation. When we medically manage a miscarriage and let you go home to the comfort of your own home for things to happen either expectantly or naturally, or with the use of tablets, we're doing it on the understanding that you know the door is open to you. If you have pain or bleeding at home that you can manage, then you are safe to stay in the confines of your home with your own bathroom. If you have pain or bleeding, however, that is troublesome, or that you're concerned about the distance from the hospital or the supports, please let us know. We do frequently admit people who have these concerns or who have significant pain or bleeding to allow them to miscarry in a safe setting in the hospital. You need to come into the hospital if you have pain that is unmanageable or bleeding that is too much for you. So again, it's very individual. But again, we would provide you with support numbers for the hospital, for the early pregnancy assessment unit, for the emergency room. So if you need us, we are at the end of the phone. If you go to the emergency room when you're miscarrying, you need to know what the plan is for you. You need to know the contact numbers for the hospital, the contact number for the emergency room, and again, when should you expect to hear from the hospital? What's the next step? Typically, when you present to the emergency room, there's a referral sent to the early pregnancy assessment unit, and you will be getting notification from our administrator there for a scan, usually within 24-48 hours. If you've had bloods done in the emergency room and are told to expect a call, that call will typically come in the afternoon from one of our midwives in our early pregnancy assessment unit. So you need the information not only in relation to your follow-up, but also information into how to contact the hospital should you need us after that visit.